Tuberculosis or TB remains one of the most significant global health challenges of our time, affecting millions of people worldwide, especially in developing countries. TB continues to impact lives and communities. In this video, we will explore the basics of TB, including how it spreads, its symptoms, treatment options, and how we can work together to prevent it. Let's dive in. We're faced with the question that what is tuberculosis? TB is an infectious disease caused by bacteria, primarily affecting the lungs. It spreads through the air when an infected person coughs or sneezes, releasing tiny droplets containing the bacteria. TB can exist in two states, latent and active. In its latent form, the bacteria remain dormant in the body, and the person is not contagious. However, when TB becomes active, it can cause severe illness and is highly contagious. Now, it would be very useful to understand how TB spread. The disease is transmitted when a person with active TB coughs, and the bacteria travel through the air. Certain factors increase the risk of infection, such as weakened immune systems. Conditions like HIV, diabetes, and malnutrition make individuals more vulnerable. Close contact with someone who has active TB also increases the chances of getting sick. This is why TB is more common in crowded or poorly ventilated environments. What are the symptoms of TB and how is it diagnosed? The most common symptom is a persistent cough. Other symptoms include chest pain, especially when breathing or coughing, fatigue, and unintentional weight loss. Early diagnosis is crucial. If you or someone you know is experiencing these symptoms, it is important to seek medical attention promptly. Doctors can diagnose TB through a combination of physical exams, imaging tests, and lab analysis. Treating tuberculosis requires a combination of antibiotics, usually taken over 6 to 9 months. Adhering to the prescribed medication schedule is absolutely critical. Skipping doses or stopping treatment early can lead to drug resistance, making the disease much harder to treat. It is also important to be aware of potential side effects and report them to your doctor. With proper treatment, TB can be cured, but it requires patience and commitment. One of the biggest challenges in the fight against TB is drug resistance. There are different forms of drug-resistant TB, including multi-drug resistant TB and extensively drug-resistant TB. These strains require longer, more complex treatment regimens and are much harder to cure. This is why prevention and early treatment are so important. Drug-resistant TB is a growing threat, and addressing it requires global attention and resources. Prevention is key to controlling TB. The BCG vaccine is one of the most effective ways to protect children from severe forms of the disease. Infection control measures, such as wearing masks and improving ventilation, can help prevent the spread of TB in communities. Screening high-risk groups is also essential for early detection and treatment. By identifying cases early, we can reduce transmission and save lives. The future of TB control lies in research, global collaboration, and eradication efforts. Developing new diagnostics, drugs, and vaccines is essential to staying ahead of the disease. Global collaboration is also critical. Coordinated efforts between countries, organizations, and communities are needed to fight TB on a worldwide scale. Eradicating TB is an ambitious goal, but with continued research, investment, and cooperation, it is achievable. Tuberculosis is a global health challenge. But together, we can overcome it by understanding the disease, supporting those affected, and investing in prevention and treatment. We can work towards a world free from TB. Let's join hands to end TB once and for all. Thanks for watching. Don't forget to subscribe and hit the bell for more. See you next time.